welcome to Dr. Fundi Health Matters podcast. Today, we are going to be tackling a matter of national importance. Many people who follow the news will be aware that there has been a matter that has been trending on TV, on radio, and even in the newspapers. The matter is relating to medical aid tax rebates. Some of the headlines are saying, goodbye medical aid tax rebates. And quite a number of South Africans are actually up in arms with what has just been shared. Just to fill in people who are not aware, what are we talking about? So earlier this week, the National Department of Health, they were presenting at the National Council of Provinces, that is in Parliament, about, plans to do away with the tax rebates. These are the tax rebates that people who belong to medical schemes get, as part of them being members of medical schemes, which therefore reduces the amount of tax that they pay to SARS. So now many are not so happy that they will no longer be able to have to submit, proof of what they pay to medical schemes and also any other out-of-pocket kind of expenses as a way of reducing the tax that they pay to SARS. So it's basically going to hit people in their pockets, literally. And so, they are not so happy. And so we thought, as much as we have done, some episodes, some podcasts in the past dealing with NHI, this is a matter that is, again, part of the broader conversation around the NHI fund. And so we will recap on some aspects of the NHI fund so that we can create a base of information so that people can then understand what is this issue all about, why are people upset, and whether it is actually a good thing for it to happen, or actually is one of the things that might lead, the government to be taken to court. So we don't know. So I'm not alone. As usual, I've got my co-driver, Mr. Sipho Masiho. He will be probing, asking some questions, hoping that I'll be able to elicit, or share some information about some of the aspects that are talking to this issue. So sit around, listen, and hopefully, this content will be value-adding to you, because the issue of the NHI is becoming a reality, and the sooner we interrogate it, the sooner we engage about various aspects of it, the better it will be. Most people are still in denial that it is something that is likely to happen, but I can tell you that there is commitment from the government side to make sure that this thing happens in the near future, at least by 2026. So the sooner we accept the reality, because once it's legislated, then you are going to be forced. So, Mr. Masiho?
Good morning to you, Doc, and welcome to all the people that watch the Dr. Fundi channel. It's a pleasure to be back, Doc. I've missed you, man.
Yes, but it's been a hectic last few weeks. We have recorded a lot of content, offsite for different things, so we needed to catch up with that. Yeah. Yes, I've also been missing being behind the mic, but I've also been enjoying, some of the good stuff that you guys have been pushing through, with the shorts. I mean, I've got one of the videos that is hitting over 50,000 views around, the issue of concubines in the Pondo culture. So, keep those shorts coming, but let's focus on today's topic.
Absolutely, Doc. Before we start with our conversation, you did mention that the media is saying a headline saying goodbye to medical aid. So I figured let's start the show with that clip to hear what the media has to say.
Lovely.
Back. Now, you may have to kiss your medical aid tax credits goodbye. Government plans to use these rebates to fund the first phase of the National Health Insurance. And this was contained in the presentation to the National Council of Provinces. But some are questioning the constitutionality of this proposal. There are also concerns over the funding of the scheme and corruption as well as maladministration. So let's get some clarity now from Dr. Nicholas Cripps, the Deputy DG for National Health Insurance. And thank you so much for your time. A very warm good morning to you, Doc. Thanks for joining us. I suppose let's start with what informed this decision that medical aid tax credits will be used to fund the NHI.
Morning, Jamila. Good morning to the viewers. That's been on the cards for the best part of 10 years already, and it's in the bill, so it's nothing new. For those who have actually read the bill, they will have seen that it is covered as one of the options for moving funds. So the point of the exercise really is that if all funds are going to be paid by the National Health Insurance Fund once it's established, then we need to move them from wherever they are at the moment into the administration of the National Health Insurance Fund. And it's a question of sequencing of which of those sources of funding move at what point.
So, Doc, that's the clip, and of course we'll be hearing a lot more from the DDG of Health to help us understand exactly what's happening.
Yes, that was the DDG of the National Department of Health, Dr. Nicholas Cripps. He is the man that is actually, driving all these processes from the National Department point of view, and so it was actually appropriate that they asked him to explain some of these things, and we're going to be using some aspects of that video to help us in our conversation around this topic. So yeah, but basically what he's saying is this is stuff that is nothing new. It should have happened long time ago, and anyone who's been keeping up with the developments on the NHI fund should have been aware of this, and there shouldn't be any surprises. And yes, as one of the people who has been following this for over a decade, I mean, since around 2009, I've been following the developments in the space. I can agree with him that this is something that has long been discussed, and we thought even more than 5 years ago it would have been put in place. But it's now happening, and it's happening in real, and not everyone is happy about it.
Absolutely. So my first question for you, Doc, to help me understand, and of course to all our viewers to understand what this NHI bill that was introduced to us, it speaks about the UHC. What is the universal health coverage, and what is the obligation of the state to ensure that we have universal health care?
Yes, I think it's very important. I mentioned earlier that, yes, we have covered various aspects of NHI in the past.
Yes.
But it doesn't hurt to recap some aspects as a way of helping people to understand why the discussion we're having today. So I think the first thing we need to understand is that South Africa is a member country of the United Nations, and also the World Health Organizations. So certain things that are happening at that level, actually guide us as a country in terms of what we need to do. So just the starting point is that as a country, we subscribe to the Article 12 of the UN Covenant on Economic, Social, and Cultural Rights. That was, already from 1966. And this provides for the right of everyone to have enjoyment of the highest attainable standard of physical and mental health. So this is at a UN level.
Okay.
We subscribe to that Article 12 of the UN Covenant. But also, at an African context, we subscribe to the Article 12 of the African Charter on Human and People Rights, and that came about in 1981, even before this new democracy that we are enjoying now. And this provides for the right to enjoy the best attainable state of physical and mental health. And it requires of the state to ensure that everyone receive medical attention when they are sick. All right. So now, when we then talk about universal health coverage, we are talking about ensuring that every citizen of the country has got access to affordable, quality health care. And it shouldn't depend on one's ability to pay. So at a WHO level, there was a resolution taken that by 2030, every country that's a member country of WHO should actually put in place some form of universal healthcare coverage, meaning no one should be left behind when they've got a health challenge, physical or mental. They should not be left behind. It shouldn't be that they don't have the money at that point to be able to access healthcare. And so this is, from those multilateral organizations. But if we bring it even closer home, as a country, we have a national constitution that was, passed in 1996. And Section 27 of that national constitution says everyone has a right to have access to healthcare services, including reproductive health. Yeah, that's 27.1. 27.2 then says something about the state has a responsibility to take reasonable legislative and other measures within the available resources to achieve the progressive realization of that right of access to healthcare. So as a country, subscribing to the UN, the WHO resolutions, and also our own constitution, we should not be having a situation where any of our citizens have got a challenge in accessing healthcare, because it is now recognized in our constitution that healthcare is a basic human right. So that is therefore the thinking around this universal healthcare coverage. So what is therefore happening is that whilst every country must put some form of universal healthcare coverage, in our setting in South Africa, we are committed to that universal healthcare coverage, that is everybody getting access to healthcare. So that is the dream, that is the vision that we are working towards as a country. Because we're not in a dictatorship here, so you can't wake up and there's a decree that this thing must be there. So there's been parliamentary processes over the last, over 5 years now, public consultation and everything, and people submitting, information to Parliament, to the portfolio committee that was dealing with this matter, so that as many people as possible can actually share their views or opposition to what the NHI bill of 2019 has been saying. So the NHI fund, National Health Insurance Fund, is what this NHI bill is actually looking to set up. Okay. All right? As a vehicle that will take us from where we are to the desired future being universal healthcare coverage, where everybody has got access to healthcare irrespective of their ability to pay. So it is therefore important for people to understand that NHI and universal health coverage are not the same thing, but one is a means to an end, the end being universal healthcare coverage. Universal health coverage. Yeah. The other one being the vehicle that takes us there. So the establishment of the National Health Insurance Fund, which the bill is basically about, its creation, is that tool that will take us there. But it's going to take a period of time for that to be rolled out. They are looking at 2026, to do the early part of it. But it doesn't mean nothing happens between now and 2026, because there's a lot of legislative things that need to be put in place. There's a lot of governance things that need to be put in place. How to set up the board of this NHI fund, how to make sure, you recruit the executives, the CEO, the functions of that, how to ensure that there are the necessary committees to run this thing, but also advisory committees to the minister, because the minister is going to have a lot of power in terms of how this thing must function. So there's a lot of work between now and that 2026. And so this issue of these tax rebates is just part of the preparatory first phase kind of problems.
Absolutely. So let me make sure that I understand you correctly. So the vision is the UHC.
Yes.
The vehicle is the NHI.
The NHI fund.
The NHI fund is the vehicle that gets us there.
Now, I think we need just to clarify a few things.
Okay.
So this NHI fund, it's about how the system will be funded.
Okay.
All right?
Yeah.
How the system will be funded. It's going to fund both, it will fund the delivery of health services.
To all citizens.
To everybody. So the fund itself, it's a funding mechanism for the delivery of healthcare services to all South Africans. And that delivery will be through public health facilities and also private health facilities. And each of these facilities, before they can actually be able to see patients under the NHI, they will need to be accredited and certified by the Office of the Health Standards, which will then look at, these are the minimum standards required for you to be able to, see our patients and all of that. So this is the preparatory work. But the other work on the legislative side is nearing completion, in Parliament and then to the President. But, there's also, other things that are happening in the same time.
Absolutely. So, Doc, I just wanted to just check with you.
Yeah.
You did mention in your response now that there are two health systems at the moment.
Yes. So in South Africa, we have a situation, part of it is about the legacy of the past. We are a country with the highest level of inequality in the whole world.
Yes.
And that inequality shows itself in many ways in education, whereby those who can, they send their kids to the private education system. And the majority of people can't afford, they send to various levels of the public health system. Yeah. So even in healthcare, we've got that inequity. The haves, those who are privileged to be employed, they are able to access medical schemes and become members to cover themselves and their family members. So in a way, I would say they are privileged, even if they are, what we call, normal workers, but the bottom line, they've got access to medical aid, so they are privileged. So you've got then the private healthcare system that is largely funded through, the private health insurance, which is medical schemes, and what we call out-of-pocket expenses, those people who can pay, but also indirectly through things like these tax rebates. Yeah, so that is the funding on the private healthcare side. And sometimes there may be also certain, NPOs that are funding, on the private health side. But on the public health side, which covers about 86% of South Africans, the funding is basically through government, and also some grants that the government may get from some of the NPOs, some of the NPOs like let's say the Melinda and Bill Gates Foundation, and other Global Fund, PEPFAR, that is on the HIV and AIDS side, money is coming from the US to fund HIV and AIDS and TB, so but to simplify this thing, public health is largely funded through taxation.
Okay.
Private health is largely funded through medical schemes, and these tax rebates.
And the out-of-pocket.
And the out-of-pocket.
Okay.
You see, so that is it. But what is important is for us to understand that just over 14% of South Africans are now medical aid members. It has dropped. I mean, I attended sort of a symposium this week where the latest figures showed that it's something like 14.7% of South Africans who are on medical schemes, as opposed to 84.3 or something. Is it 84? No, about 86 point something that are now, reliant on the public health system. But what is of interest, though, is that the expenditure from both of these is almost the same. It's almost the same. So this 14% of people is costing, or at least when you look at the amount of money that they are using on an annual basis, is as much as what is being used for the 84%. So, and that's a problem. That's not sustainable.
Not even.
And it's perpetuating, obviously, the differences, whereby ACPO may not be able to access healthcare, from the south of Johannesburg, may have to wait a much longer time to access healthcare services because of the congestion in the public health system, like Kobara, as opposed to a Dr. Fundi Lenyati who stays in the northern suburbs of Johannesburg, who has got about 5 or 6 private hospitals around him.
True.
And therefore can be able to access services only because he happens to have a medical aid, or have a job that pays a little bit more than an average South African, So that kind of inequity is a problem. And in fact, our minister talking at the National Parliament when they were going to vote on the NHI bill, he said there are 2 trains that are running on 2 separate lines with little interaction between the 2, and both of them are heading for disaster. So the public health system is definitely heading for disaster. Things are not working. There are still pockets of excellence, but things are not working. On the private healthcare side, many people think that private healthcare all is well. No, there are challenges there as well. Remember I said the medical aids are the primary funding method for private healthcare. And then out of pocket and all of that. But many people are starting not to be able to afford medical schemes. They start by dropping the choice of package, buy down. At a certain point, they stop to be members altogether and just get hospital plans because things are tough financially. So, and that's part of it, why there's been a drop in the number of people who are covered. Because from an economic point now, people are not able to afford these subscriptions. So both systems are heading for disaster, and there has to be some reforms that will address this problem. And so this radical, what people see as radical introduction of the NHI, as a funding mechanism, but also a system of health care that is going to cover everybody, it's an attempt to actually address the issue of healthcare access once and for all. But obviously, like any change that is being introduced, there will always be, the father of change Nicola Machiavelli, who lived in the 15th century, an Italian, he actually said there is nothing more difficult to implement than change. Why? Because those who are currently benefiting from the status quo will defend and resist change.
Yes.
They are strong. And those who see the light may not be as strong in supporting the new order. So if you are overseeing change management, whether at government level or organizational level, you must anticipate resistance. And I can tell you that the introduction of the NHI fund and the system of healthcare that is based on that is definitely causing a lot of unhappiness. Many, institutions, many groupings have threatened that they are going to go to court to try and stop it. And I don't think those are idle threats or empty threats. These are well-funded organizations that can be able to delay this thing for the next 10 to 20 years if things go their way. So basically, that is the state of the health system in South Africa, which no responsible government can actually allow things to go ahead, the way things are going. And so, like I said, Section 27.2 of the Constitution says the state has to make reasonable measures within the law to address the situation. And so the NHI fund setup is part of that obligation by the state. And when you talk to many people, they are not really opposed to universal healthcare coverage as a principle, that everybody should have access to quality healthcare. No one is opposed to that. The opposition is the how. How do we get there? And because the governing party and the government is proposing the NHI, others think we can get there without having to introduce NHI. So now when you talking NHI on one side, which is about to be considered and approved at the NCOP, and then you are already seen to be taking something from these very angry people, it's a recipe for disaster.
Absolutely. So, Dek, my next question then is, because I think you've answered one or two of my other questions, but I wanted to find out, so if you're saying that the private healthcare is funded by...
medical schemes largely, and then the tax rebates and out-of-pocket expenses.
So let's talk about the medical aid rebates. How does it fund the private sector? And how does the individual benefit from the funding of the medical aid rebates?
So you have Mr. Sipho Masigo, who works for the city of Johannesburg, or is self-employed. It's him, his wife, and maybe 2 kids. And so on a monthly basis, Sipho is paying somewhere around 6,000 rands a month, being a member of one of the top schemes, Discovery or, whichever other medical scheme. So at the end of a year, when it is time to do e-filing, you will get something a certificate of membership that also shows how much you've contributed, from the medical scheme.
In that financial year.
In that, yes. You will also have receipts or slips of where you paid out of pocket. You submit that as part of your e-filing. And by submitting, if you were supposed to pay maybe tax of 20,000 rands, those expenses, especially if there was hospitalization and a lot of out-of-hospital, kind of out-of-pocket payments, you might find that your tax payment to SARS may reduce maybe to 15,000. So that 5,000 that you did not pay to SARS is a benefit to you, because you would have otherwise paid 20,000 to SARS.
Makes sense.
Now because you can prove that you are a member of a medical aid, you've spent money on medicines, you've spent money maybe covering the shortfalls on hospitalization, and all of that helps you to claim a rebate, which therefore means less money that you have to pay to SARS. SARS sort of, so you won't get the money you won't necessarily get the money in your pocket, but it would mean you paying less. But sometimes people do have, a situation where when they are adding up all of their expenses and everything, they get a tax refund. Yeah. So the bottom line is that as an individual, depending on your expenditure on the private healthcare side, you definitely will get a benefit in terms of tax rebates or even some refunds, when you're looking in total. So those things from a medical aid point of view or private healthcare point of view, are going to go away. And that's what is making people to be unhappy, to say, oh, okay, I knew that once it's announced that the e-filing is starting on the 1st of July, I'll submit this and that, the amount of tax I'm paying will be reduced. I may even get a refund. So you can get a refund from other things, but not now. But obviously it's not yet in effect, but that's what is being communicated, that in the near future, that is what is going to happen. And that money that would have benefited the individuals will now be redirected to be used in the in the setup of the National Health Insurance Fund.
Oh, it makes sense.
You see, so
it's not coming to the individual; it's going into the fund.
It's going into the fund. Okay. The first phase of the fund, because there are still other methods of funding NHI that have not yet been finalized. For example, a surcharge on income tax, contribution by those who are employed starting from a certain salary level. For people who are unemployed and the indigent, the government will have to contribute into the fund. And then there are also grants, like I told you about, for HIV, AIDS and TB, and also for the national system grants. So the point I'm trying to say is that this is the first step of redirecting funds. And there's always been an argument from other quarters that, why should the government subsidize medical aid membership for the affluent, who are already affording? Why don't they take that money that they are subsidizing, which is the rebates, and channel it to the ailing public health system? So other people are actually saying this thing should have been done much, much more like many years ago, because it's been perpetuating or worsening the inequity. So, but then if you talk to people who are beneficiaries of medical schemes, they are going to say something different. I'm a beneficiary of medical schemes, and I know that it's definitely going to make a difference in terms of my e-filing once this thing starts.
Absolutely. Doc, you were on 702 this morning, being a Saturday, and of course, that's your regular slot where you talk medical matters.
Yes.
After your conversation, Doc, on our way here to record, I heard people that were so angry. I mean, there was a white lady who said this bloody ANC government is going to steal all this money. Hey, Doc, that lady was angry. She was probably the worst out of all of them.
Yes, no, sometimes, in South Africa, we are still in the euphoria of winning the Rugby World Cup.
Yeah.
Congratulations to the Boks once again.
Absolutely.
When people are angry,
yeah,
sometimes they revert to their languages. That lady was speaking English on 702. This is after I had actually been answering questions around this goodbye medical aid tax rebates as part of my topic today.
Yeah.
So after I finished that health feature, there was just a flood of voice notes of very angry people, and you had some of them. there is a nice word in Afrikaans that is called gatvol.
Yeah.
Mense gatvol. Ele is gatvol, and they like, these guys, they just want to control every aspect of our lives. They haven't finished chowing the monies, and in other ways now they want to come and chow the money and force us to rely on their medical, on the public health system. So they are very angry, very, very angry, because the producer phoned me afterwards and said, "Eish, Yane, ziyakhala." Many people are very angry.
Yeah.
So yes, there's a lot of anger. I think the anger stems from the fact that people are not happy about the NHI bill, number one. Even though it's not yet been fully adopted because NCOP has not done it, but they can see that this thing is nearing reality. But also they are not angry because not so long ago they saw that the very people that we entrust with the public purse, they don't think twice in terms of dipping in if they can do it during a pandemic like COVID-19, then they can do it. If they can do it in a funeral of Mandela,
or the floods,
then nothing will stop them. So I think the issue of trust, the trust deficit. So there's a lot of anger, but I must also say, in the very radio station you're talking about, there were also those who are actually in support. So it was not just one way angry people. There are those who are in support, who are actually saying this thing is long overdue. It should have been done long time ago, because why actually benefit those who are already privileged? It's the same argument that if SIPO, not use SIPO. If one of our, a production team members here, Figo, if he goes to a bank and he wants to buy something, because he's still young, he has just started working, he's not been working for 10 years. So you'll find that the bank is going to charge him very high interest rate.
Yes.
Yet he's actually starting to work. And then the same thing when Dr. Nyati goes there, who obviously financially, because of the number of years that I've been working, they will charge me prime or prime plus half or sometimes prime minus 1. That is like 3 or 4% less than what they are charging him. In fact, for him, it would be like he has gone to a mashonisa. They charge him prime plus 5, prime plus 8. So
instead of enabling him.
So life is unfair like that. Capitalism is unfair like that. Those who've already made the money, things become a little easier for them. And yet those people who are still entering the economic space, who should actually be getting breaks, they actually get charged more. I mean, if you go and buy airtime, prepaid airtime, it's very expensive per second, the prepaid airtime, compared to the same for the people who've got a contract like me.
That's true.
So life is unfair like that. So even in this situation, people are saying, these people are already affording. They've got jobs. Why give them a subsidy? When they opt out of the public health system, why don't you redirect this money to the public health system? So that's the other argument that is out there. So not everybody is angry. Other people cannot wait for this to be a reality.
Absolutely. So, Doc, I think at this case, let's hear from the DDG as well, as he responds to how people are reacting to it. We also have a voice note that has come from a young lady who's also not quite happy about this whole arrangement. But let's take a listen to the DDG first.
Lovely.
There were concerns raised, Doc, when it comes to the medical tax credits. Let's talk about some of those concerns, perhaps. I'm sure you've also seen or heard of them as you address them in the NCOP around the constitutionality of this?
Yeah, Chumela, look, I think there's lots of opinion and there's lots of people who have different views and different angles and who disagree with national health insurance and afraid of change and afraid of corruption and afraid of all kinds of things. But I think that what we have tried to explain over the past 20 years and in the period leading up to this through the National Assembly's Portfolio Committee engagements and now into the NCOP is that the current health systems, both that what we see in the public sector and the private sector, are now on a serious spiral of decline. And we are going to get in even bigger trouble than we are now if we don't act. And the challenges we have is that neither of these systems the funding of neither of these systems is efficient. It's not effective, and we spend a lot of money considering the poor outcomes that we get. We need to be far more organized and far more operated in a far more cohesive way.
Doc, that's the first response from the doc, and of course, let's head and listen to the voice note that has just come in from one of the young people.
So my question, as a person who contributes towards medical aid monthly, is how is it fair that they're going to take this rebate away when the only reason we need medical aid is because the quality of public health care isn't at a point where we can all be helped in the way we need to be helped on time, on a regular basis. That's the only reason we need medical aid, is because we need private health care, because the quality of public health care is not at its substandard. So how is it fair to take away the rebate for the people who are basically backed into the corner of having to go to medical aid in the first place?
There you have it, Doc.
Wow. It's actually an interesting thing. What she's saying there is we would not have taken private medical schemes had you got your act together and provided quality healthcare services. We would not have dipped into our pockets to cover for ourselves because we no longer trust you.
Yeah.
That's what she's saying. So she's saying now you are actually penalizing us for actually lowering the burden because you are not delivering. Now you are chasing us and taking from us a benefit that is due to us because you forced us to go that way. I think she's got an argument. An argument. But then somebody else will say, the bottom line is that you are able to buy medical insurance. It means you are privileged. We have a constitution in South Africa that actually talks about equality, and equity. So if we are equal, why is it a 14% of South Africans are getting subsidy in the form of rebates and then 86% are getting nothing? So the paying of rebates to a minority who are privileged is actually unconstitutional. That's what other people would say, because you are not treating us equally as the citizens of this country. But then she'd say, but I'm already contributing to the tax base, but you failed. So actually, I've had to dip more into my pocket. So I'm saying there are cogent, there's good arguments to be made on both sides. And maybe we need to get to a point where we actually just get to be treated equally. So in a way, I think this universal healthcare coverage and the vehicle that takes us there, being NHI fund, maybe is the thing that will equalize things. And then obviously those who can afford to contribute to the NHI, but also be able to buy top-up medical schemes for those things that are not covered by NHI, then they can enjoy that. So because once the NHI is in full operation, that may be still close to 10 years from now. I'm talking about full operation. Then medical schemes as we know them will cease to exist. That is, I think it's called, Section 33 of the NHI bill. So they will cease, but when it is fully operational.
Okay.
And then, the only schemes that will be available will be those that cover what is not covered by the basket of services under NHI.
Those are your top-ups?
The top-ups, yes.
Covers some shortfalls or whatever?
Well, not shortfalls. There won't be shortfalls, but you might find that somebody who's got a gallbladder that is messed up, it's got stones or is infected or whatever, and it needs to be operated on.
Yeah.
Long time ago, would have to cut on the tummy and go and deal with the gallbladder. All right? It's a cheaper way to do it, but it leaves you with a scar and it takes longer for you to recover.
Okay.
Nowadays, we use what we call laparoscopic surgery, where we just open on the navel and then insert a camera and something that can actually do this thing under, a video and whatever, and then we remove the gallbladder or sort it out, and then we take it out. There's only one little stitch that needs to be put there. Within 3 days, you can go back to work. But the problem is that those that are technologically advanced are much more expensive. Yet the stay in hospital is shorter. Now, what is likely to happen, because this is going to be a fund for everybody. So certain procedures that are actually quite good but more costly may not be covered by the NHI fund.
Okay.
So that they can stretch the money to cover many people.
Yeah.
So in such a case, then if I need to have laparoscopic surgery, I can then go to my top-up medical aid to cover me than for me to go for the old-style operation of how to deal with the gallbladder, which might take me a week or two for me to recover. So the issue of cost and quality, they're going to need all the time, to compare the two. And so there definitely will be procedures that may not be done. If you've got a fractured hip, there may be a need to go in and operate and put in the screws and whatever, which we call internal fixation. But that can be a bit more expensive to do compared to sorting you out and putting you on a POP, a plaster of Paris, So there will be procedures. That's why there's an advisory committee that's going to be deciding every year what should be in that basket. So if something is not in that basket or it's seen to be cosmetic, and therefore not necessary, or somebody's got big boobs.
I was about to ask that.
Somebody's got big boobs that are actually hurting their neck, they are hurting their back, but NHI doesn't want to cover them. So then those people who have got a strong medical reason to have a reduction of the breasts to lower the strain on the back may have to then go and do the top-up. You see? So the point is there will be things that will be included and there will be things that will be excluded. So if you can afford to pay your contribution to the NHI fund, which will be collected via SARS to the NHI fund, but you can also be able to afford to pay for a top-up. Like when you buy a car, they'll say, okay, if this car is involved in, say, write-off, they will pay maybe 75% of the value, but then you'll have to come up with the 25%. So the top-up is for that 25%. So the point I'm trying to say is that it's still going to be quite tricky. There's a lot of things that are not yet known. And I expect more fights going forward.
Speaking about fights, Doc, so you did say earlier on that there are organizations, NGOs, that might take the government to courts, your higher courts as well as your courts. Is that a possibility?
It's a strong possibility. Already, after the adoption of the NHI bill by the National Assembly, a lot of organizations, doctor organizations, medical scheme administrators and medical schemes, political parties, they have promised the government that as soon as this bill is signed into law, they are going to take it, to court to test the constitutionality of it. And so even this matter of the tax rebates, I think it will be a dress rehearsal of the bigger fight that is coming, because already, people are talking about questioning the constitutionality. Tumelo, the ENCA, was it ENCA?
ENCA, yes.
Yeah, Tumelo from ENCA, the host, she actually said it at the beginning, that there are threats, to test the constitutionality of this. I'm not sure if it will win, because ultimately, if we keep things as they are, it's unconstitutional. It's treating the citizens at different levels. The haves, they continue to get some rebates, whilst the don't haves are struggling to access even the basic, healthcare services at primary healthcare level. So I think personally it will be a futile exercise. It has been good whilst it lasted, but I think this is one of the, as a human being, you need to know and choose the battles that you want to get into. And I do not think it's a battle. There's a bigger war for them, which is the NHI bill in its totality. And maybe they should be reserving their funds for that, to force the president to take that bill back for further consultations and everything else, But to start fighting this, because at the end of the day, it's up to the government to give the rebates or not to give the rebates. I think it's a weak argument. I would rather, if it was them, not do that. But at the same time, people have got resources and they believe they can challenge this. And we'll see.
Absolutely. Doc, we've got 7 minutes to go. There's a clip I wanted us to play off with and perhaps also respond to this question when we come back from after the listening to it. Basically, Doc, now people have raised issues of corruption, mismanagement of the NHA fund. Are they justified and concerned about the money being used for corrupt purposes? So I'm going to play this clip so that we hear the response from the DGG.
Yes.
And then you then can take over and then
wrap up.
Okay. So let's take a listen to this.
We will see a different approach. We should be systematically reducing the tax credits and redirecting that money into the public system.
When we talk about also other concerns, Dr. Crisp, I mean, what is your answer in terms of alleviating any concern around government's capacity to manage this process, but also corruption and maladministration when it comes to these tax credits, amongst other things?
Yeah, well, we should be concerned. Every South African should be very concerned. We have a history in the recent past of abysmal management and very poor record regarding corruption in the public sector. We see huge amounts of fraud in the private sector. They are raised on a weekly basis, and we see patients, doctors, hospitals, all kinds of people being reported, both in the public and the private sector, stealing from the system in one way or another. So we should be worried. We should be very concerned. But it's not unique to the public sector, and it's certainly not something that must prevent us from fixing what is broken at the moment. So we believe that, number one, having many different funding streams and many different ways of delivering healthcare opens us up for a whole range of perverse incentives. And people will abuse those perverse incentives if you allow them to. If you simplify the system and we all benefit from the same benefits, we all know what we are entitled to, the practitioners all know what they can expect and know how they are going to get paid, you already reduce the risk. But you can never get rid of all risk. So you have to manage the risk that you can't design out of the system by flagging the digital systems and by making sure that you follow up immediately when there are challenges that are highlighted when people do behave in a way that one does not expect. And it's those patterns that anybody in any risk management system will be looking out for. So what we need to do is once the bill is an act, we will publish regulations on what we call the governance aspects of the National Health Insurance, and they cover sections 12 to section 30. And that's where we all must engage very proactively with who will be running this fund, how exactly will the board be created, how will the board report to whom, why, and when, what other structures, management committees, and people will be the fit and proper persons that we will trust as citizens to run our system. So that is where the rubber hits the road, as we say. But I would not disagree with anybody who says that we should be concerned and we should be very vigilant. What I will disagree with is that we shouldn't fix the current systems.
So there we have it, Doc.
Yeah, I think the DDG is, how do I put it? He accepts the fact that there is, this trust deficit. That is people against their government based on experience, their daily experience in terms of what's reported. So he says it's a reality. People will always look at ways to abuse the system. But at the same time, he says you can't, just because of that risk, not proceed with the reforms that are much needed. Rather, adopt a point of risk management. Manage the risk because you can't eliminate it 100%. Manage it and be able to move from point A to point B. That is, point B being towards the UHC. We can't, just because of the corruption risk, sit and do nothing. That's what he's saying. I think they will really need to do a lot as government once this bill has been signed into law. Those governance structures that they are going to put in place. I'm looking forward to seeing the quality of the people that they will actually bring to be in those boards. Because we know, once again, they are creating a mega SOE. And we know what has been happening in the SOEs. The kind of people that historically have been put there. Some of them, whilst they are good people who go in there wanting to do good, but there are many of those who are put there to push certain agendas that may even benefit some politicians or other interest groups. So it would be interesting to know how are they going to select people that would give comfort to South Africa, that they are not there to line up their pockets or their friends' pockets. So I think that will be the biggest challenge. And according to the bill, that's the first thing that they are going to do, is to set up this board. And having set up the board, they will set up committees that will look at this and that, and set up advisory committees appointed by the minister. So this is long before the thing starts to work.
Yeah.
So I don't know because, there's many people who are tainted in South Africa. We have seen with state capture, how this thing is so pervasive, corruption and stuff. So I think the taste of the pudding will be in the eating Once we see the names of the people that they're going to put into these boards, it will tell us whether we are looking at a different SOE or it will be the continuation of those who want to feed in the trough. So we can't tell now, but we can judge by the people. The thing that says we can judge your character by the people that you surround yourself with. Yes. So we will judge their governance standards by the people that they put there. If they put compromised people who've got a history of chowing, wherever they are put in a position of looking after the public purse, then then I think the credibility of this NHI will be at stake long before it starts operating. So let's wait and see. But I'm worried that people who are clean, people who have got integrity, people who abangamathandazwe, patriots, who are skilled, who have seen many having their names soiled when they become board members in some of these SOEs, when they don't want to facilitate the chowing, then their names are actually dragged into the mud. So such people may not even want to raise their hands, in which case will then be stuck with the ones who are looking to line their pockets. So we'll see. We'll see. The recent history does not give me confidence. But at the same time, I must say there's many South Africans who want South Africa to progress and work. And so they'll have to find a way of giving them independence, because unfortunately when you are in these kind of institutions, when you are independent-minded, then you are seen to be a problem. And many people who have the necessary, attributes to run clean governance are not always people who are yes men, to politicians. And so, it's going to be interesting.
Absolutely. Doc, I think we've come to the end of our conversation. I've learned a lot. Thank you very much for enlightening me. And of course, I hope the audience have enjoyed our conversation. So I don't know if there's last comments on your side.
I hope so too. This whole NHI fund thing, it's a huge elephant that needs to be eaten bite-size. So today we're talking about the rebates and recapping a bit about NHI. And I'm sure in the near future, once the NCOP approves this thing, we'll find another aspect of NHI to talk about. But I hope today's discussion will leave people with a lot of thinking and hope that we were positive enough. We didn't leave them with a lot of negativity. South Africa is a country that's alive with possibilities. And we've just seen that, you can win a World Cup by just winning with 1 point. 1 point in the quarters, 1 point in the semis, 1 point in the final. So things may look bleak, but we seem to have a way of making things happen when we think it's all lost. So let's be positive. We are in this thing together. We don't have another, most of us don't have another country to run to.
Yes.
We have to make it work.
Absolutely.
Yeah.
Doc, that was fabulous. Thank you very much.
Thank you.